MCare Solutions Incorporated is the nation's original provider of transfer DRG reimbursement services to healthcare providers. And with more than 300 hospitals, MCare is also considered the industry leader. Why was there a need for transfer DRG reimbursement services? More than 10 years ago in 1999, the Centers for Medicare and Medicaid Services, or CMS, initiated reimbursement policies for the diagnostic-related groups, also known as DRGs. These policies involved the amount of money that a hospital would be reimbursed when a patient was transferred from a hospital to a post-acute care facility, such as a skilled nursing facility or home health agency. At the time, CMS was reimbursing hospitals at the full DRG rate, while also sending the post-acute care provider a full payment. CMS decided that it was overpaying and that something needed to change. So CMS established what are now known as transfer DRGs, with lots of edits and checks and balances incorporated into the CMS payment systems. And as most hospitals have learned, CMS does a good job of recognizing overpayments and taking them back. But what if a hospital was being underpaid? And underpayments happen often. It's nearly impossible for hospitals to predict a patient's post-acute care and to accurately assign a discharge status code at the time of discharge. It's also nearly impossible for hospitals to know if the post-acute care provider filed a subsequent claim. Determining that in hindsight would require a claim-by-claim retrospective review and submitting retroactive reimbursement claims according to individual fiscal intermediaries. Whew. Hospitals had a need, but no solution. It was then that MCare Solutions Incorporated was born. In September 2005, David Jupp, himself a former patient financial services director and revenue cycle manager for 30 years in a variety of hospital settings, founded MCare. Its mission was and remains to provide transfer DRG reimbursement recovery services to hospitals to ensure that the hospital is not inappropriately underpaid. And who are MCare's clients? Today, there are more than 300 of them, for-profit and not-for-profit hospital systems and individual community hospitals that range in size from less than 100 to more than 1,000 beds and are located nationwide from Florida to Alaska. Since 2005, MCare has expanded its reimbursement review services to include review of not only Medicare fee-for-service accounts, but also of Medicare Advantage accounts, TRICARE accounts, and Medicare inpatient rehab accounts. MCare also obtains IME and GME payments for teaching hospitals, as well as providing corrected information for accounts that are admitted as having commercial insurance that should have been admitted as having a Medicare Advantage payer. In February 2009, after a long 18-month effort, MCare successfully convinced CMS to allow MCare to conduct a 4-year retroactive review of transfer DRGs in all 50 U.S. states. The resulting reimbursement dollars to MCare's clients have been most impressive. To date, MCare has reviewed and analyzed millions of discharges and is responsible for more than $55 million in reimbursements to client hospitals. MCare Solutions Incorporated gets the reimbursement dollars to which hospitals are entitled and need. They can help your hospital too. Implementing this program is pretty painless, typically requiring just a few hours of hospital staff time. And the cost? Contingency-based, with no implementation fees to you whatsoever. MCare has an easy reimbursement calculator on this site where you can enter your hospital-specific information and get an estimate of both your 4-year retroactive and recurring reimbursement dollars. Contact MCare today and let them get your hospital's reimbursement dollars.